face of the first ever arm transplant recipient, this is how his arm looked like. So it's below elbow. And he had lost it, I think, 14 years earlier. And here, actually, before the transplant, we had to just mark the potential muscles we might have to find. It was all a guessing game. In the graft, which was taken from the dead person, we had to identify the arteries, the nerves, the tendons, and the muscles. On the stump you have just seen, we identified 2 arteries, 3 veins, 2 nerves, 16 out of 21 tendons, and the muscles. Elbow, okay, which has been dissected to identify all the structures I just mentioned. Battlefield, you see, it's quite complicated. That's why it took 14 hours to do. But it is a historic case because this was the first ever, as you mentioned, successful one. In 1964, the Ecuadorians tried it, but the patient died.
Yeah, I saw it was because of the wrong immune suppression.
Exactly, there was no immunosuppression at that time. Again, we had to do some skin grafting to cover all the gaps. It's like a puzzle. And this is the surgical technique which was used. We had to use a tourniquet. We anastomosed the arteries, the veins, the nerves, etc., using the microscope. And you can see here that the patient required immunosuppression immediately after, using, the tacrolimus, MMF, which is mycophenolic acid, and prednisolone, which is steroids. After the transplant, we were doing routine biopsies to identify any sign of rejection, and there were no rejections. This is the arm, you see, this is the arm, and actually this was in London. He came and I took biopsies and I sent it to the hospital. As you can see, it is an impressive outcome.
So how long did it take for him to be able to use
This was actually 6 months exactly when he came to visit me. Then we had a problem, as you know, and I had to remove the arm in London. We did some functional MRI on him. That's a very interesting story because you're doing medicines quite significant, where the left hand and left elbow below and after, before and after the transplant, and it highlights, look at this,
the motor regions.
Exactly. When he moves, it lifts the brain, which is incredible. Now this is the second transplant, who was French, Denis Chatelier. I mean, look at his arms before the transplant. He was the first ever bilateral arm transplant, and that's why I prepared for you this picture, which is again very historic. And this is him after the transplant. Look at him. These are the arms. Almost, few weeks after the skin is healed, but things have improved a lot, as you can see from the picture here.
So in one of the review articles that I read before, they said that a lot of the national surgical bodies didn't want this surgery to happen because they thought that compared to just a prosthesis, you were putting the life of the patient at risk through immunological rejection.
We've done it. First, I wanted to do it at St Mary's Hospital in London here, but unfortunately they said no. So they said no, and then we had to find someone else to do it.
The actual surgery, you have to be attached to muscles, tendons, nerves, bones, ligaments, and then skin.
Yes.
So many things can go wrong, but I saw that they try and evaluate the gain of muscle of function afterwards. And so how do you think it's increasing?
I think the maximum anyone can get is around 65 to 70% success. And this is the reason why I'm saying this, that when you auto-transplant an arm which has been severed, that's what you get maximum.
Compared to now, is the technique increasing?
No, because you see, it was
the same.
pretty good technique. See, there's a limit to how much. There's a limit to how much you can, you join vessels. And then the microscope was there. Everything was done very well. What would be different now, to be honest, is to have a bionic arm which acts exactly the same as an arm, which they are working on. This is the future. I don't think that the arm transplantation is a future if you start having something so efficient, to work on, like the robots now in theaters. You see, they just do all those moves exactly.